Biomechanics of head injury. Head injury can be broadly classified into two types based on mechanical loading. Static or contact injuries occur both at the site and are removed from the point of impact on the head. It results in skull fractures and contusion. The length and direction of a skull fracture depends upon the amount of kinetic energy, amount of contact energy absorbed by the skull and its thickness at the impact site. Dynamic or inertial injuries. Dynamic loading is usually a result of an impact, such as the head being struck a blow by a moving object or the moving head itself striking relatively stationary surfaces. Inertial injuries are commonly called acceleration or deceleration injuries, which biochemically can be considered as the same phenomenon. The brain is damaged by one or more both mechanism through strains produced within the brain tissues itself and through differential movements between the brain and the skull. Strain within the brain tissue is the deformation that it undergoes when a mechanical force is applied. Tensile strain refers to elongation of neuronal tissue and is the most important mechanism in head injury. Compression, wherein a constituent unit are being forced together. Shear or a sliding strain, which move adjacent strata of tissue laterally, also occur. The brain is virtually incompressible, has a low tolerance to tensile and shear strain. And next is about the classifications of mechanical loading. That is, mechanical loading is classified into contact injuries. That is, contact injuries, static injuries, blow to head required, head motion is not necessary. That is, in contact injuries, a local skull bending, skull volume changes, shock waves. Local skull bending, skull fractures, linear fractures, depressor fractures, extradural hematoma, Coop contusion. Skull volume changes, basilar fracture, counter Coop contusions. In shock waves, intracranial hemorrhages. And also in dynamic impact and impulsive. Impact contact is also the impulsive. That is head motion injuries. Dynamic head motion required a direct blow to head is not necessary. Translational, rotational and angular. Tissue strain, deformation, injury. And there are theories are also brain displacement theory, pressure gradient theory, skull deformation theory, transmitted wave theory, vibration theory, rotational shear force theory. Thank you.